Hi, this is Amir Alakaam, and I am an associate professor and MBH program director in the University of Tennessee at Chattanooga. And today we will talk about nutrition for opioid use disorder and recovery, or sometimes we call it substance use disorder. So some of the learning outcome today that you will hear about is recognize nutritional needs and challenges for pregnant person struggling with substance use disorder or during recovery, review common side effects of medication and how they impact nutrition status, identify nutritional intervention strategies that may enhance recovery and prevent recurrence of substance use. So those are the learning outcome, and I hope we will cover them all within this 45 minutes. And you will see I have also some overview about how the opioids usually affect the brain mechanism and the GI tract um, uh, mechanism in general, motility in general, and this have a great impact and the main impact on why we have issue related to nutrition for OUD individuals, and we will highlight all of this during this presentation. So some questions before we start, and in the end of this presentation, I will have the answer for you. So please take a minute and read those pre-tests. So what do you think about in US facilities, it is common practice for patient in OUD treatment to receive nutritional intervention. Is this true or false? Opioid use changes the brain mechanism that affect taste and odor. For example, sweet food will be highly pleasant. And the last question, eating habits among individuals with OUD include eating more than usual meal, eating less meals, consuming fewer soft drink and snacks. So overview, the number of individuals seeking treatment of opioid use disorder continues to increase in the US. In 2020, more than 2.5 million individuals aged 12 or older has OUD, and among those, 2.3 million individuals had a prescription. More than 130, and actually recent study and recent data from CDC said even about 69,000 individuals die every year, which will put us about 190 individuals die every day due to opioid overdose. This is more than cancer, more than death due to breast cancer, and more than the death due to the car accident. So this is really a huge, big issue that we are facing today, and whatever intervention we will do to reduce this kind of issue, it will really help impact the health status of the in general in the United States, and also will improve the economy because a lot of money is putting on the healthcare system to deal with OUD. So what are the nutritional needs and challenges among persons with OUD? So and today we really specifically talk about the pregnancy and women's during lactation and during pregnancy. So pregnancy is a time when adequate nutrition intake and healthy weight gain are very important for both mother and infant health. Opioid-induced effect in the central and gastrointestinal system. So this is really affect the you will see there is a major impact of the opioid on the central nervous system and the GI tract neuron system. And this is actually all the side effects related to nutrition. It's because of this big impact of the opioids on how the receptors and the neurons act in the nervous system after the individual have opioid. The effects are primarily due to the activation of opioid receptor within the enteric nervous system, and specifically in the smooth muscles and in the terminal of peripheral neuron in the GI tract. opioid basically suppress neural activity, which leads to slow digestion, delay gastric emptying time, and intestinal blockage. And you will see actually the main side effect and the main issue that OUD individuals suffer from is constipation. And this is really due to all of those activities that happening in the neuron level in the GI tract. So this, in order to understand how, why opioid affect the GI tract and the nutrition and the eating habit of the individual, let's talk a little bit about how the nervous system look like in the human. So basically, we have the central nervous system, and we have also the peripheral nervous system. The central nervous system is the one we have the brain, spinal cord, and that's where you will have all the activities of opioid. So basically, we will have the effect on the dopamine receptor and the increase in the dopamine activity, and all of this happening within the central nervous system. And on the other side, we have the enteric nervous system, which is the nervous system that is located within the GI tract, within the digestive system. It's basically considered the second brain. And let me go to this slide first before we talk back about the central nervous system. So basically, the enteric nervous system is a subdivision of the peripheral nervous system that directly control the GI tract. This system is very active, is very important, is very fast in acting. So when you have this butterfly feeling when you are at fear, or when you have some issue or a mental impact, you will have this butterfly effect in the stomach. This is due to the activity of this nervous system. This actually, the amount of neurons and nerves in that system is actually equal the amount of the neurons that are within the central nervous system. So if you remember the image of all the neurons and nerves coming from the spinal cord, this is actually exactly happening for this system. So each organs in the GI tract is actually full of neurons and nerves, which all can be regulated independently. And that's why when we have we cannot actually control what is happening in that system. And you will see that's why the opioids can play a big role in controlling this GI tract motility and secretion, because all of the activities within that system. So today we know how the opioid actually activate and increase the activity of dopamine. Although in the recent study that we don't see a direct effect between dopamine and the pleasure. It's really the dopamine is not directly affect the pleasure center, but due to different mechanism that is related, that dopamine is one of them. We do have that braining mechanism. So when the dopamine increase, we do have an increase in the pleasure, and that's really the effect of opioids in our body. So think about the brain mechanism when we have a pleasure due to listening to the good music or food. This effect is exactly what happen when the person take opioids or substance. So basically, they will have that amount of pleasure and more due to an increase in the activity of dopamine. And if you can see in this picture, to compare between while you are eating food and while using cocaine, for example, you will see how much activities of dopamine is happening in the receptor level. And it's actually kind of going crazy because it is not just a normal number, it's big numbers of dopamine activity that happening at one time. So when this happen, imagine if you are eating food at the same time. So actually, no matter what you will eat or what you will want to get a pleasure from eating food, it will not be equal to the amount of pleasure happening from cocaine or from opioids in general. So that's why a person who are at opioid use during recovery or during use, actually they will have um, more pleasure happening from the opioid themselves, and that's what will affect their eating habit and make them eat less and enjoy food that is they are not usually enjoy. For example, you will see those individuals, they are more attractive for sweet because and it's really sweet, not just sugary, but any type of sweet food. And they will eat less fruits and vegetable because basically all the activities in the brain and the way they um, uh, taste and smell the food will be different than normal individual or individuals who are not on substance use. So all of this, you will see actually the eating habit of the person will alter. And this is also will happen for several weeks, several months after they recover, because the mechanism inside the brain is really changed, and it will affect the taste center and also the odor center, and it will affect all the receptors that is related to food and eating habit within the brain. So which will lead to change in the eating behavior. So what effect that the opioids do on the GI tract? So opioids basically agonists bind and activate the receptors of both enteric excitatory, sorry, excitatory and inhibitory motors neuron of the mesenteric plexus. It will also inhibit acetylcholine release, which this one is affect. The acetylcholine is actually the one that responsible on the motor action or the contraction of the smooth muscles in the GI tract. So when they inhibit the acetylcholine, that's why you'll have a slow motility and you will have constipation. It will also inhibit the muscarine neurotransmission, and all those events will reduce intestinal motility. So some of the nutrition adverse effects include effects of the appetite, reduce the appetite. Also, we will have less hormonal regulation of hunger cues. Fasting insulin level are higher, insulin resistance due to beta cell dysfunction, lower glucose clearance rate when given IV glucose solution. So we will also have a low gastric emptying and motility. We will have also low intestinal peristaltic contraction, and we will also have an increase of the absorption of fluid and electrolyte. So think about this collectively. So that's why actually we have glucose intolerance issues with the OUD, and we will also have a high constipation. And I mentioned, look to all of this. So see, there is low gastric emptying and motility. There is low intestinal contraction. There is an increase in the absorption of fluid within the intestine. All of this will lead to more slow in the movement inside the GI tract, and this will lead to constipation. So the adverse effects include constipation, nausea, and vomiting, irregular eating, in addition to less nutrient-dense food. So that's really related to the general habit of the individuals. All of this will lead to macro and micronutrient deficiency. And actually, in the end, it will lead to malnutrition. So what recent research finding that found that pregnant women receiving methadone had significantly lower body mass index than women not receiving methadone, despite having significantly higher calorie intake. And remember here, when we talk about higher calorie intake, this is really come from sweet food, that come from not a high uh, not a dense food that really come from snacks, beverage, juices that they don't have enough calories or protein or complex carbohydrate. And that's why we see them actually, they will have low body mass index compared to individuals not receiving the treatment. Also, women receiving methadone had lower serum level of folate and significantly higher homostatin level, and this will affect actually the absorption of B12. So they will have B12 and folate deficiency. Also, they will have significant lower dietary intake of folate and iron among pregnant women. And also morphine administration has been associated with reduction in the emptying of pancreatic juice and bile, which will cause delay in digestion. So those are some of the recent research findings that we will see from 2020 and up. So we will see a lot of individuals that have B12 and folate deficiency, and also they will have malnutrition and lower BMI. So with all that we discussed related in the effect of opioids on the central nervous system and the GI tract, but think about the general pictures of the individual. So usually those individuals with OUD, they have unstable food environment. They are usually live in a poor area. They don't have easy access to food that is high in fruits and vegetable. They have limited food access. They have inadequate housing, so they cannot cook. They have less food storage. They don't have cooking skills. They are unable to prepare their own meal. They have less social support, less social network. They are usually have no limited or no physical activity. All of this actually will impact the eating habit and the eating behavior in general. And it's like circle. Whatever you want to improve, if you want to, for example, improve the physical activity, this will impact the nutrition. But in this case, actually, we have it as a big issue because we have food insecurity, we have unhealthy food environment, we have low physical activity. All of this will lead to really a poor eating habit and lead to malnutrition in the end, and it even can lead to death. So we have opioids short and long-term impact. The short one, that's where you need a nutrition intervention immediately. This include blood sugar disorder, insulin resistance, constipation, nausea, vomiting, high fat, and usually they are consuming cheap food. This is all will lead to malnutrition. Constipation, decreased mortality, abdominal pain. This may lead to narcotic bowel syndrome, which is basically narcotic bowel syndrome. This is actually a case where you will have a frequent abdominal pain, and usually exaggerated by increasing the opioid dose, and even by increasing the treatment dose. So that's why this syndrome usually mismanaged, because whenever you increase the doses, you will have more abdominal pain, and basically because all the nervous system have been altered and changed within the GI tract, and it is very hard, very complicated to treat narcotic bowel syndrome. It takes a team of health provider to deal with this issue. So nutrition intervention, after we talk about all of this, I am sadly reporting that there is really no standard nutrition intervention for a pregnant person with substance use disorder or during recovery. So until today, we don't have actually a standard. We don't have a gold standard that say this is what you need to do or what you need to follow when you have a pregnant person with SUD or OUD. We just have a general recommendation, and it's really based on the studies and data that we have. However, we know a lot that we know a lot about how the opioid affect um, the person eating habit, and we will just go with the general recommendation based on the symptoms and the diagnosis of the persons. So there are no study that have evaluated the effectiveness of nutrition intervention, especially designed for pregnant person. The general recommendation is a proper nutrition, complement treatment, healthy lifestyle, and nutrition education are the principle. The key is to prevent nutritional deficiency and to decrease the risk of mental health illnesses symptom that can trigger recurrence or substance use. So really, is today I will show you what kind of steps you can take in order to minimize the symptoms and to reduce any micro or macronutrient nutrient deficiencies. And really, the main things that you can do is to prevent a malnutrition. So this is why nutrition intervention is very important for those individuals. So nutrition intervention for those with substance use disorder is complex. There are several studies that document insufficient eating pattern during substance use, including inadequate intake leading to micronutrient deficiencies and malnutrition, abnormal preference for sugared food, sweet food, and beverage have been documented. And actually, there is a lot of data that is coming from United States that show really individuals on with OUD, they usually have a lower intake of fruit and vegetable, very high intake of snacks, convenient food, sweet beverage, um, uh, all type of sweet and snacks, candies. This is which all actually replace the main meal and sometimes replace their diet for the whole day. So they will just stay and living on, for example, 2 or 3 drinks of Pepsi and a couple candy bars, and that's it. That's what they will eat the whole day, which will really lead to change, decrease in weight and malnutrition. While micronutrient deficiency and malnutrition are often corrected, um, dysfunctional eating patterns such as binging and night eating are often worsened during recovery. And this is true because think about what I talked about the brain mechanism. So what happened is the change happened in the um, um, brain activity in the dopamine level. It's really altered in a way that the brain will think is the there is the food and drink will not give you pleasure, and if you have that feeling you want to eat, you will think about opioids, and this is why those individuals will suffer from loss of appetite, and they will all their eating habit will be swinging between binge eating or night eating or not eating at all. So they might end even eating 1 meal a day, and that's when you need to focus on how to train them, how to train their brain, their mind on how to find those clues. Yes, you are ready to eat, and you should eat. When you are ready to eat, you should eat food that is dense, that will give you a very good calorie, high in protein, and high in complex carbohydrate. So early recovery should be considered a critical time to get nutritional support. Example, dietary counseling by a qualified professional such as an RDN, registered dietitian nutritionist, because each individual is different. And really the nutrition intervention for SUD is really individual. So it's based on the individual. There is no one standard plan you can follow. The registered dietitian will work with the healthcare provider and also will work the individual to find what is the best eating plan and nutrition education that we can provide in order to fix and get to fix the eating habit and also get a fast recovery. So the principle of nutrition intervention will be address any dietary concern that would be associated with comorbid condition, such as malnutrition. And this is really true. The first thing ever you need to do is a nutritional screening for malnutrition. So is the individual have a malnutrition? This will be the first thing, yes or no. If yes, that will be the main target, is to intervene the malnutrition and to prevent any further micro or macronutrient deficiencies. So you need to encourage nourishing diet and well-balanced lifestyle. Providing individual guidance can help to focus the nutrition education on specific risk factor, helping to improve the likelihood of recovery. May have newly diagnosed chronic illnesses like hypertension, metabolic syndrome, diabetes, or eating disorder. Remember, we talked about insulin resistance and glucose intolerance. This is actually by time of the patient arrive to the healthcare facility, they might already diagnose with metabolic syndrome and diabetes, and this is due to the opioid use disorder. So you also need to deal with those issues, and you need to fix the glucose. So the main four things that you need to focus on is malnutrition, the diet of the individual, nutrition education, and if there is any chronic diseases. So this will be really the principle of the nutrition intervention. So start with achievable goal. And I see this really a lot in the practice. Usually you will just put your client with a lot of information and you tell them, don't do this, don't do that. But what you need to do, especially when it comes to pregnant women during recovery. So really give them a very slow, achievable, affordable goals that they can do. Maybe start with something very simple. So schedule a regular meal and snacks. So if the individual taking only one meal, add one meal to them. So don't start big. Don't give them a very long plan of diet that they need to follow. Just add something very simple weekly, and then you will see a great impact on the individual. For example, also establish a physical activity routine, maybe walking for 30 minutes. This really will have a huge impact on the weight of the individual and the eating habit of the individual. Cooking one meal at home, adding one apple to a meal, this will really increase their fruit and vegetable intake. So you don't need to go with big things in the beginning since they are dealing with recovery. Remember, during the recovery time, the main things that they will do and the main focus, it will be the medicine. The medicine that they are taking will be the first thing in their mind, even the first thing for their healthcare provider, that you need to take this medicine. So all the nutrition will come next. And this is actually, nutrition should be the first thing to think about. But due to the fact that medicine is approved by the FDA, and this is the first line of treatment, so medicine will come first, and then the nutrition will come second. So really start with something very slow and small, adding one apple, adding one banana a day, then make it two, adding another fruit for each meal. This will really have a huge impact in the end. And then after few weeks, you can do a meal plan and find where is things that can be improved. For example, remove snacks, add more fruit and vegetable, add more complex carbohydrate. This will be later when they will have a better eating habit. So early on, individual may not be able to differentiate between hunger and craving for substance. This is really on the brain level. So this will take time, and you need to make them understand you are hungry or you are thirsty, and that's why you are thinking about the substance. Two main complications is malnutrition and eating disorder. So to deal with those two issues, you need to have a support treatment, prevent nutrition deficiency, provide resources, nutrition education, and focus on self-care and healthy eating habit. So let's talk about malnutrition, since really it's the biggest issue we are dealing with today. So malnutrition related to substance use disorder is categorized by primary and secondary. So the primary one is the happen when the substance replace other dietary nutrients. So basically, it's replace the meal, and you will take opioids instead of. So the individual will take opioids instead of all the others meal and snacks and beverage. The secondary malnutrition is result from the improper nutrition metabolism. This is related to the GI tract level. So basically, when the individual take the opioids, they do go to the GI tract and absorb, and on the receptor level, they will replace the absorption of vitamins and minerals. So that's why you will see a lot of folate and P deficiencies on those individuals, because basically they cannot absorb in the same way that absorb in a normal individual. So a study showed 70% of those with substance use disorder suffered from vitamin D deficiency and low level of vitamin C. You look to that number. This is almost all of them, actually. They are suffering from D deficiency and vitamin C. So when you are dealing with individual on SUD, you do really ask for a lab that examine the vitamin D level, vitamin C, and vitamin B12. Another study showed that 50% were sufficient either in iron, vitamin A, C, or E during withdrawal from substance use. And again, all of this will actually affect the recovery and also affect the general symptoms and signs of the individuals. Actually, in fact, some of those deficiency can lead to chronic disease. For example, vitamin deficiency, D deficiency for a long time can increase the risk of inflammatory disease. So it might lead to even diabetes mellitus or narcotic syndrome and other diseases. 6 potential indicators of malnutrition: weight loss, loss of muscle mass, loss of subcutaneous fat, localized or generalized fluid accumulation that may sometimes mask weight loss. And truly, I did see many patients that they look like obese. Their BMI actually put them on overweight and obesity, but they are malnourished. So this is a very common, especially on the individual that they are old. So you will see them, you will weight them, and you will think they are obese. They are far from malnutrition, but they are malnourished, and their malnutrition is severe. It's actually can lead to death. Reduced functional status, so ability to perform normal daily activity. So they, for example, they cannot prepare food, and insufficient energy intake. Again, obesity may mask malnutrition. So weight and BMI alone are not sufficient. You need to look for muscle mass, subcutaneous fat, and use other measure to diagnose malnutrition. So one of the very important things that you can do, and does not need to be done by a registered dietitian. This can be done by any individual, even administrator that are dealing with substance use disorder clients. So there are several tools that you can use in order to diagnose if this individual have malnutrition or at risk of malnutrition. Couple of the tools that are common used in the United States is Malnutrition Universal Screening Tool, Malnutrition Screening Tool, MST, and Patient-Generated Subjective Global Assessment. And I will talk more about the MST and the BG tool. So both of this actually, they can be used inpatient and outpatient. And I did see a lot of wiki clinic, for example, they use them. And it's something you can basically some health facility, they have a policy that any patient or any client that you see in the clinic or an emergency room, the first thing you need to do is to use the malnutrition screening tool to see if they are at risk of malnutrition or not. And then you can take the next step. So the BG is the most commonly accepted tool for screening and assessment. It is supported by many studies and validated in both inpatient and outpatient setting. It is an in-depth screening tool. Items are completed by the patient and the healthcare practitioner. So basically, this tool actually is also very common used in outside United States in different countries, and also used very common during pandemic. So you can see here, the patient need to complete the weight, the food intake. It can be self-reported, but it also have some measures into it. So you need to put numbers. You do need to have someone that with the patient that describe the tool for them, and give them some direction. Let me see. So this is how it looked like. For example, the patient can say during the past 2 weeks, my weight has increased. I have more than usual in my food intake. What kind of symptoms they have, they can put them, and any activities of friction. So this will put them on, there is no intervention required, or they do need to patient and family education by dietitian. They require an intervention by a registered dietitian, or they indicate a critical need for improved symptom, or they need a nutrition intervention. So this is really based on the calculation of that tool and that assessment method. Then you will have numbers, and based on that, you will take action. So that's why this actually does not need to be done by a registered dietitian, but it does need some sort of healthcare provider to control and to describe this assessment tool to the client. The other screening tool, and in the recent year, there is a lot of health facilities, they are replacing the BG with this one, because this one is very fast. It can be done by administrator, and it can just keep the client safe and give you, it's a very quick to use, and it can take you to the next step, whether the patient at risk or not, or whether they need an intervention. So it is a very short questionnaire. It's only 2 questions. And depending on the answers, patients are classified into 2 categories. Either they are at risk of malnutrition or not at risk. So the advantage of the MST is that it is quick to perform and can be completed by healthcare or administrator staff. It is well validated, and it shows a high sensitivity. So this is the questionnaire. And actually there are a couple versions of this questionnaire. So there is this one in kilogram, there is a one in pound. And you can see it's basically give you a very quick score. And based on that, you can say, okay, this is at risk of malnutrition, and I need to refer them to a registered dietitian. So what is the medical nutrition therapy for malnutrition? So the medical nutrition therapy, the MNT for malnutrition, include correction of any deficiency. So if there is vitamin D deficiency, you need to correct that immediately. Providing an adequate diet, and if there is, for example, if there is a dehydration, you need to give a good amount of IV fluid or by mouth fluid. Also addressing any alteration that need to be made to the diet due to the oral, digestion, or metabolic issue. So for example, if they have diabetes, or they have insulin resistance, then you need to provide medication, and also you need to understand those individuals may not respond to IV glucose the same way that a patient with diabetes mellitus and they don't have opioid disorder, they will have a different response to glucose, to IV glucose, than a patient with OUD. A once-a-day low-potency multivitamin mineral supplement may be useful for those unable to consume an adequate diet or those with severe gastrointestinal damage. So a diet with a complex carbohydrate, moderate protein, healthy fat, and less sugar actually is recommended for constant recovery. Avoid high protein diet as it can stress liver. And this is really true if the patient have been on OUD for a long time. So you do need to be very careful with the protein because this might impact negatively the liver and the kidney. Review hunger and thirst cues, encourage consistent meal and snack, and watch for increased sweets intake, emotional eating, and binge eating. So long-term nutrition education to sustain recovery. So a target for adequate calorie intake. Once able to meet the calorie need, focus on incorporate nutrition-dense food to improve any nutritional deficiency and decrease symptoms that could lead to relapse. So really look for fruits, more vegetable, more complex carbohydrate, for example, whole grain cereal. Also focus on fish, beans, all of those that have a good nutrient. Continue to encourage nutrition goals that include macronutrient and micronutrient as part of the comprehensive healing process. Some of the micronutrients that you can focus on is, for example, for the carbohydrate actually they will help in the production of serotonin, and this will help to promote happy and stable mood. So this will also facilitate any energy generation and will also help to increase the level of B12, B6, folic acid. Fat also, really, you need to focus on omega-3 fatty acid and omega-6 fatty acid, not just because those are really help in the function of neurotransmitter receptor, but will also help in building any defect that happen in the GI tract. So this will also reduce the inflammation. So whatever inflammation that happen in the GI tract, actually omega-3 and omega-6, they will help to increase the recovery and shorten the recovery time. Protein is also important. Hydration is very, very important, and you need to give a plenty amount of fluid. Micronutrients, some of the important micronutrients include iron, vitamin D, vitamin C, B vitamin, and folate. So all of these are important. And remember, those specifically is important because opioid will alter the absorption of those micronutrients. So it's very important to focus on this, especially in the time of recovery. So what are the recent research findings on the nutrition education? So a research, this is just to give you an idea about how important is the nutrition education. So a research served 152 registered dietitian and the clinical nutrition program managers about the nutritional support in both residential and outpatient use, a substance use treatment program. They found that the presence of nutrition education within the unit at the treatment program was correlated with participant addiction severity index score. So basically what they found, actually, the severity will reduce with the implementing of nutrition education program. In order to, the nutrition education actually improve the score. So that's why it was very helpful to use a nutrition education as part of the intervention method of during the recovery. So this is actually what I have for you so far, and now I will answer some of the post-test questions that those questions that I presented in the beginning of the presentation. So although, despite we know that there is a very important role of the nutrition intervention during the treatment, but today actually it's uncommon in the US facilities to use a nutrition intervention. And I hope this something will be changed in the future, but the answer for the first question is actually false. It is really uncommon today, and I hope this will be changed. So yes, opioid use changed the brain mechanism that affect the taste and odor. So even those individuals, actually, if they don't enjoy sweet food before, after they use opioids and during the recovery, they will start enjoying things that they never enjoyed before. So candies that very sweet, they will enjoy it, and they even will consume more of those items, and even the smells will be changed. So this is true. For three, eating habit among individuals with OED include eating less meals. So actually, they will have weight loss due to eating less meal. They will consume higher soft drinks and snack, and they will not have more than usual meals. So in summary, nutrition plays a very important role in promoting wellness during the recovery process, helping to reduce recurrence of substance use and accidental overdose or death. Individualized nutrition intervention, and this is very important. Actually, each individual is different. So that's why we need a nutrition intervention that is specific for individuals. So individualized nutrition intervention and education should be an integrated component of treatment plan. A balanced and healthy diet should consist of complex carbohydrate, moderate protein intake, healthy fat, and variety of fruit and vegetables to meet nutritional needs. So this is really the general recommendation and the plans of any nutritional intervention for OED for pregnant person, or also for um, uh, um, someone dealing with opioid disorder. Here are some resources to have more information related to diet and nutrition intervention. And here's the references. Thank you so much for listening to this presentation. If you would like more information, please contact me. I have my direct phone number here and also my email. I will be happy to answer any question you have. Thank you so much.